All right, today, values, ethics, and advocacy. Let me tell you something. Make sure you know what it means in terms of what is value, what is ethics, ethical principles. You definitely need to know this because ethical principles, believe it or not, will continue to you'll continue to see it throughout the nursing program, and you may get it on NCLEX because it's actually a part of the NCLEX test plan. All right, somebody go and tell me what in the world does value mean while I pull up. What is value?
Beliefs about the worth of something, about what matters, that act as a standard guide to one's behavior.
Say it in one more time in Alejandro language. Yeah.
It's about like what you believe in that matters the most, and it'll be like how you behave yourself in a way.
Okay. When it comes to client or nurse-patient or nurse-client relationship, should I care about what a patient values versus what they don't value? Should I even care?
Yeah.
I mean, listen, as long as I prevented you from being 6 feet under, I think that's the most important thing. Why should I care about what's important to you or what's not important to you? Oh, bestie, look at you, yeah. Mm-hmm.
Because what everybody values is different.
Okay, true. What everybody values is different.
Some people's beliefs don't allow them to have blood in certain situations. You give them blood against their beliefs. That's a big sin on their part. I mean, that can mean a lot to somebody.
Oh, so you saying I have to make sure I incorporate the client's values or what they place as high regards or importance into my care plan when dealing with these clients, is what you're saying. Okay. All right, Cornelius, what sayest thou?
That's exactly what I was going to say.
So, Chanel, so your answer?
You have to incorporate their values to effectively care for them. Otherwise, they won't stick to treatment plans.
Oh, good. Value systems. Now, like we said earlier, like I said earlier, it's about your beliefs, what you place high regard on, and it's what influence how you value, how it influences an individual to take care of their human needs, like it says, their health, their well-being, their illnesses. Okay? If Mason comes in to teach a client about ostomy care, and the client does not care about what Mason has to say because they don't believe that they're not sick, that client is not going to take Mason's words seriously. Probably won't even pay attention to Mason. Probably might even shoot the Mason out the room. You understand? Like, bro, I'm not about, some of them will, okay? They actually will do that to you. So yes, you do need to know what is important for the client versus, and what also they place high regards to. Chanel gave a great example. If a person deems it's unnecessary or it's against their religious belief or spiritual belief to taking blood or blood products, you need to incorporate that into your care plan. Just because their hemoglobin level is low doesn't mean, or even critically low, you need to find other ways for them to see what can we do to get your blood levels up. We're not gonna go ahead and call the court system or call the powers that be, but let's see what we can do. Maybe we could get you eating certain foods, for example, or try other alternatives. Does that make sense? Okay? All right, very good. Now, you do need to know that. All right, common modes of value transmission, modeling. You do need to model how representation, what you do, I'll do, okay? You see that a lot between parents and kids or teachers and students, etc., etc. You also have moralizing. Now, what is moralizing, Joanna?
Moralizing. Oh, you're looking at Anthony, look up at you.
I hope it's right. Go ahead.
Like, your morals, like what's important.
Okay, you can't define a word with the word now.
What you believe is the right thing.
Huh?
The right thing.
What you view is the right thing. Okay, can you elaborate a little bit more? Give me something else. No.
The
Trinity, what else would you add to moralizing?
Telling somebody, like expressing what's right or wrong.
Okay. Say it again. I'm sorry. I didn't hear the last part.
Telling
Like
somebody-
preaching?
Telling somebody how to act morally.
Okay, all right. Preacher. I wasn't expecting the preaching part, but what do you mean by preaching now? Because now you open that can of worms.
Like getting like
Sanctimonious. Ooh. Okay, we getting churchy. All right. Alexandria, what says thou with regards to common modes of value transmission, moralizing?
Is it like more so
Now, what was the answers in the book somewhere, right?
like judging people instead of
No.
Like what?
like judging people based on your own beliefs instead of like kind of just going into it.
Kenosha, do you agree with all the definitions that were provided with regards to moralizing?
I think they're on the right track.
They're on the right track. Okay.
But leaving it to the church and the school to bring that input of the belief on the children instead of modeling from parents, right? Like church.
You can give them.
Okay, first of all, okay. Okay, what you mean? What page is your answer on?
119.
Okay, just so we all know, on the same page, 119. Okay, tell me, read it, go ahead.
Children whose caregivers use the moralizing mode of value transmission are taught a complete value system by parents or institution, church or school that allows little opportunity for them to weigh different values.
So in other words, what's in Kenosha's term? Lingo, what does that mean? It's a what?
Your morals are what you've been taught. Is it like right based on
It is about right and wrong, yes.
whether or not,
It's what I
however
said.
you were raised in church, those kinds of things, but it's what you're taught is how you perceive your morals. Like some people are raised differently than others, and some people's morals are different than my morals because of the way that I was taught. Or even with bringing church into it, what your beliefs are
Okay.
make up your morals.
They shape
What's
you.
right and wrong.
Okay, they shape you, well, how you define what's right, okay. What do you mean by primary influence? And none of the answers were wrong, by the way. I just want to hear your thoughts. What do you mean by primary influence,
Like,
Anton?
it's just like not to go into specifics, it's just like your influence.
Influencing what though?
Your value system.
Yeah,
Yes. What do you view as basically like what's been said? So it can be influenced by church, it can be influenced by school, it can be influenced by your upbringing in terms of home upbringing. Like some people, they know based on their upbringing not to go into people's house and put their feet on people's table. Other people, they will do that because of their upbringing. Okay, they don't place moral. It's your moral guide. It's what guides you throughout this thing called life. Okay, laissez-faire. What is that?
Leaving it up to them to decide what they want to do. Or approach. I don't know. I kind of read it before.
Okay, kind of ready to the book. Go ahead, say it again.
Leaving it up for them to decide on what is right or wrong or what they decide their value is going to be.
So you have no one or no institution nor a group of individuals guiding your what's your compass, your moral compass. It's like I throw spaghetti on the wall. If it sticks, it sticks. If it doesn't, oh well. All right. If I find this important, I'll act on that. If not, And then rewarding versus punishment basically is what?
They're rewarded for showing like whatever they've been taught, like values that are like good.
Mm-hmm.
And punishment, the same as like your morals if you're teaching your child or whatever and they do something bad, well, obviously, like in your like eyes, your own morality.
So you place value on something based on what you were punished for or what you were rewarded for. So let's take the law for example. I will not run a red light because I know that I will get a ticket if I get caught. Okay, so the law, so I'm influenced by reward and punishment. Does that make sense?
Yeah.
I know that if I help my student Trinity who's on the floor and crying and stuff. Okay, well, maybe not say crying. Trinity don't look like a crybaby, but you was broke, your arm broke or whatever, and I took you to the hospital, and I knew that I would be compensated. I don't know. Then I'm rewarded. Then I'll do that. You understand what I'm saying? So those guide your it's like your moral guide based on reward versus punishment. And then of course the responsible choice, which is pretty much self-explanatory. Now, professional values. This you better not play with me for sure. When it comes to professional values, you have this thing called altruism, which will definitely show up on one of these assessments, okay? Concern for the well-being of others, okay? That's altruism. I'll make sure, because I'm concerned about my students, I bring them food every day, at least in my mind, okay? Huh?
Because you're concerned for our welfare.
Yes, okay, that's why. My pockets won't allow for it, but in my mind, all right? Now, autonomy, right for self-determination. Cornelius, what does that mean, the right for self-determination?
You can, by yourself, make those decisions. You don't need somebody to tell you what to do.
Okay, very important. And guys, autonomy is not, when you're answering these questions, it's not limited to just the patient making an autonomous act. The nurse also, or the other healthcare providers also act with autonomy. Like for example, if the nurse comes into a client's room and they see the patient is turning blue, they went and go ahead and put on that oxygen. That without a physician's order, for example, that's the nurse acting autonomously. Does that make sense? Yeah. All right. So don't limit autonomy or all of these values just to the patient only in these questions, all right? Then, of course, you have human dignity, which we've talked about for some time now, which is basically respect for the inherent worth and uniqueness of individuals. This is why, for example, when we do bed making, we provide what? Privacy, because we want to maintain that patient's dignity, right? And then there's this issue of integrity, because we act with a code of ethics. Code of ethics, you'll hear it multiple times throughout this program, because we as nurses, we act on a code, okay? We have this thing that we abide by, okay? Which provides also the standards of practice. And then of course, social justice, where we make sure we uphold moral, legal, and humanistic rights, which is pretty much self-explanatory. But definitely make sure you know all of these values, because this is how we as professionals provide care, not only for the client, but also we as professionals, how we do what we do. All right. 3 main activities: evaluating, processing, choosing, pricing, and acting. To be honest, I ain't gonna test you on it, but it's good for you to know. Choosing is basically choosing freely from alternatives, and pricing is make sure what you value, that's what you give pride to. And then of course, acting is like combining one's choice with consistency and regularity. Now, when it comes to ethics, however, you must know this, right? Ethics is the study of principles of what is right and wrong, right? What's good, what's evil. You must know this. Yes, you should know about bioethics, ask questions such as what kind of person I should be, but then there's also nursing ethics. You shouldn't leave the nursing program not knowing what is nursing ethics. You're going to hear it periodically throughout the program as well, which is basically a part of bioethics, but it's a formal study of ethical issues that arise specifically for nursing practice. All right? And then, of course, like we said earlier, morals is personal, is what you deem is right and what you deem is wrong personally. Okay? All right. Now, you should notice the two categories of ethical guidance, but I'm not going to test you on this utilitarian versus deontology. That's a lot of philosophy. But this right here, do not play with me. You see? I'm going to take my time on this one. Because I bet y'all going to get me. No, y'all going to be the first cohort. I'm going to call it into existence. Y'all are going to be the first cohort which give me no problems as it relates to the principles of the ethical principles. Number one, we already talked about autonomy, and what is it again, Anton?
The right for self-determination.
Okay, and you translate that in Anton's language?
My right to act on my own beliefs and
Or act independently, okay? Yes. Now, there is this thing called non-maleficence or non-malfeasance, I don't know how you pronounce it, okay? And then beneficence. You see what it says? Non-maleficence is avoiding harm or avoid to cause harm, whereas beneficence is benefiting the patient. What you do is on benefit of the patient. Cassandra, if I ask you to give me an example, let me see if you can, of non-maleficence, what would you say? Would you see and read it? It says avoid causing harm.
Okay, so I can think about the example, but I cannot hurt the patient and my action may be unconsciously. It's not my intention, but maybe by accident. I don't know.
All right, call on somebody. Shayla? See? See, I wasn't going to call you till later on. Because Cassandra found it worthy to you to give an example of non-maleficence.
Maybe like drawing blood on someone, or
And that the act of drawing, it could be, but drawing blood, you saying, is an act of non-maleficence?
No, I'm saying like a physical act.
Okay. Look at these people who want to raise their. Call on somebody. Brianna. the one who did not raise her hand. It's like basketball. They're like, I'm free. And she's like, no. Give it to the person who's got it. Let's go. Brianna's like, I know where your car is parked. Let's go, Brianna. An example of non-maleficence.
A nurse giving a patient medication.
Is it an act of non-maleficence? Okay, listen.
It might be the wrong dose.
Huh?
Like,
Remember, it's avoid causing harm. I need an example of an act where the nurse avoided causing harm. You see, you got all these people who want to.
She's double checking to make sure she's giving the patient the right dose.
She's double checking. Okay, so she's giving a medication, but before giving the medication, she's double checking to make. Okay, because when you double check, look how she saved that stuff. Okay. All right, call on the next person because you got a lot of people that want to raise their hand.
You can go. Holding a bed if there's allergies.
Oh, that's another good one. Oh, because that's. Have you seen some of these test questions already? I'm just saying. Patient is allergic to, give me something that they're allergic to. Penicillin, common. And the medication has a derivative of penicillin. The doctor, the medication in and of itself is not penicillin, but it has a form of penicillin. And you notice it, the fact that you call the doctor to clarify that order and recommend something else, that's non-maleficence, because you know if you go and give that medication, the patient you're avoiding harm because you know if you give that medication, the patient's going to have an allergic reaction. Does that make sense?
Yes.
Carlos?
Would that be on the nurse or would that be on the doctor?
Nurse. Because you're the one giving the medicine. Doctor just placed the order.
Yeah, but you always have to make sure that it's still the right order.
Exactly.
You always have to double check it no matter how.
Double and sometimes triple and quadruple check sometimes. Okay? So another example. Let's say, for example, the patient's blood pressure was consistently running high. All right? The blood pressure was, then the blood pressure went down to, let's say 100/60. Still normal. But it's a little high. You know, if I give this medication, yes, I know, yes, it's still normal. And when we get to vital signs.
No, you said 100/60 was high. I thought that would be.
No, it went down to 100/60.
Okay.
It went, let's say it went from 180 to 70. Let me give a high number. And then the next time you go check the medication, the blood pressure, the patient's blood pressure is 100/60. And you have this medication for blood pressure. Okay, the fact that now their blood pressure is 100/60, you know if you give that medication, what's going to happen? It's going to drop further. The fact that you refrain from giving that medication, that's an act of nonmaleficence. Patient is crying, you gave tissue, you patted them on the back, that's beneficence. You're doing good. Patient is in pain, you gave pain medicine, that's beneficence. You didn't avoid anything. You have to make sure you see the avoidance in that scenario. Does that make sense? Mm-hmm. Okay? If you don't see the nurse avoiding anything, then it's just beneficence. Are we clear on that? Potassium level is supposed to be, for example, 3.5 to 5. Patient's potassium is 7. You, like the prudent nurse that you are, you checked it was 7, and then you have an order to give potassium. The fact that you did not give the potassium, that's an act of non-maleficence because you avoided harm. Does that make sense? Brianna's example was pretty good. I caught that one. Okay, see? All right, justice, that's pretty much self-explanatory. You treating everybody fairly. 2 patients in pain, you're not going to treat the one who got money in their pocket versus the one who don't have money in their pocket first. Does that make sense? Okay? Fidelity, veracity, accountability. Now, privacy and confidentiality, that's pretty much self-explanatory. We already know we're supposed to maintain HIPAA. Okay, I forgot what the HIPAA stand for is in the book, okay? HIPAA, making sure you're keeping the patient's information private, securing their information. But when we have fidelity, what is fidelity? Being loyal. Whoa. Okay, loyalty and faithful. Okay, I don't know. Every time I see fidelity, I think Fidel Castro. I don't know why. Okay, loyalty, faithful, keeping your promise. Veracity is what? Telling the truth, the whole truth, so help you. So you're being honest. Truthful. Now, common example of fidelity. Medication. Patient is, you told the patient that you're going to come back in 10 minutes to give them their pain medication. You actually came back and gave their pain medication. You were faithful. You were committing an act of fidelity. Yes.
Would another one be like preparing a patient for procedure and telling them the possible side effects?
Oh, no.
Why?
Of fidelity?
Oh, I thought you said veracity.
No. Okay. But veracity, now, this one you're going to have to be careful. You said preparing them for a procedure, and what else you said?
And telling them the possible side effects.
Okay, that ain't your job.
It's the doctor.
It's the doctors. And we'll talk about that later on. You got to be careful with that. But telling the patient, okay, yes, we will be post-procedure, we're going to be providing pain management, fluid management, making sure we get you up and ambulated. You telling the truth, okay? Now, in terms of veracity, it does get a little grayish in terms of what veracity you can No, it doesn't. For example, let's say if the patient is suicidal, they tell you their plans. You can't say, "Oh, I'm not going to tell anybody," because now it's an issue of safety. Even though they said, "Don't promise me you'll never." Now you have to be like, "No, I can't promise you that," because what is important now? What's the priority? Their safety over you keeping their promise, over that rapport, that trusting relationship. Okay, if it has to be broken, it has to be broken. And also in terms of giving out information, privacy. You need to know who you can tell what. Who can you tell what? Oh, before I said go into veracity, fidelity. Another example of fidelity. A lot of nursing students like to mess up on this one is, let's say Shayla is transferring from med-surg to now, what type of nurse you want to be? NICU, critical care nurse. But she was working in med-surg. And she's now a new nurse going to travel, be a NICU nurse. She has also committed an act of fidelity when she's attended the trainings required for NICU. That's an act of fidelity. When she read up on everything there is to know regarding taking care of patients in the NICU, that is an act of fidelity because what Shayla is doing is promising to keep up to date so she can provide quality care for those specific patients. Is that making sense? So if you see anything regarding education, attending webinars, doing CEUs, that is fidelity. Are we clear on that? Veracity, telling the truth. Accountability, being responsible for your act. Okay? Whether the outcome was positive or negative, you are responsible for your action. Okay? Privacy now is keeping the patient's, part of privacy, is, of course, is keeping the patient's information private. Now, let's say Carlos have a patient who is awake, alert, oriented ×3, status post open heart surgery, and the spouse wants to know everything regarding the patient's care. Can Carlos go ahead and talk about the patient's status to the patient's spouse? Yes or no? Jackie, you say no?
No,
Why not?
not without like consent
Okay.
of
When
some sort.
elaborate with.
Well, just because that's somebody's spouse doesn't mean that the person who just went under surgery allows that spouse. They could be on the verge of divorce. You don't know what their situation is. You can't just give information out just because.
Very good. Chanel, you was gonna say something?
No, I was gonna say the same thing, that, yeah, pretty much the wife has to, and the husband's alert, so he has to be able to give consent to her. She can't just go and ask questions.
Right. Not only that, and even if he did, let's say she is listed as his next of kin, real world, you could say, listen, you could go to ask your husband, directed to go talk to the husband who is awake, alert, oriented ×3 for that information. You want to be careful about what you divulge. Okay, pretty good. I got another scenario for you. All right. I work on a unit with all of y'all right here. Carlos is the charge nurse. Carlos, I'm angry. I need to go on break. And I'm taking Mason and Kenosha with me. Okay? Would I have violated HIPAA if I said, Chanel, cover my patients because I'm about to be out for an hour, maybe 2. I need you to cover my patients for me. You know, this is what's going on in 601, this is what's going on in 602, etc. Have I broken HIPAA?
No.
Why not? I divulged information.
We're working all on it.
Because she's in.
We're the same.
Yeah, we're working on the same patient.
Okay.
Interdisciplinary team.
Okay, cool. Me, Kenosha, and Mason, we're about to escape for a little bit. Go down to Mickey D's, Chipotle, and Mason felt like he wanted PDQ. Okay? So we, I don't know. Okay, it's like, what the heck is PDQ?
What?
Do you know what PDQ is?
Yeah, it's like the
Chicken.
worst version of Chick-fil-A.
Oh, okay. Damn. All right. So basically that's what he wanted. So we're going to be out like 2 hours. Whoa, 2-hour break. Because Carlos is cool like that. So we all get a report, and I go and we like, Kenosha, girl, let me tell you what happened to patient in room 602. The drama. let me tell you, 602 status post, that vasectomy and shit. And baby mama number 1 came in and talked and found baby mama number 2, whatever, and baby mama number 3 is saying she pregnant, blah blah blah. And Mason's like, yeah, this, I want to be like this, bro, when I grow up. We just talking about have I violated HIPAA, and we all work on the same unit, though. No, but we work on the same unit. No, but okay, you said it that. Okay, is that medically related? Okay.
That's the
Kenosha?
T. That's not.
Okay, fine.
You did. You told him that he was post vasectomy.
Thank you. That is post vasectomy.
And wouldn't it technically be breaking it because you're talking in a public space where other people could be listening?
Yeah. Yeah, give her a sticker.
TikTok payment.
No, I was dragging the puzzle on there.
Pick one. All right, but what if we were in the car? It's us 3 because we ride into these different locations. Wait! You didn't even hear me out, Jackie. Hear me out.
Okay.
We all on the same unit, mind you. We're colleagues. Not only are we colleagues, we are nurses on the same unit. I gave report to Chanel. Kenosha gave report to Lisa. And Mason, he gave report to somebody. Okay? Somebody. Hopefully it's a charge nurse. He's like, yo, charge, figure it out. Okay? So, but we in the car riding. And I'm like, yo, guys, listen, patient in room 610, he just had this procedure. And it's not looking good. It ain't looking good. I don't know what to do. What am I gonna do? Like, bro. And then the wife of 610 is asking me all this stuff, and then 611 got pus galore, and then this patient in my other room got diarrhea galore. I don't know what I'm gonna do. Like, have I violated?
Yes.
But I didn't spill no tea. I gave medical information.
You can't do that outside of the medical facility. You can't discuss someone else's degree, what's going on with them, the diagnosis, any of that nature outside of the other person that is taking care of the patient themselves.
Okay.
Like you can't go to like someone else, some other doctor and tell them, oh, I got this patient that has blah 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 blah. That you're breaking HIPAA.
Chanel ain't gonna give me no break. Okay, what if we did take our 2-hour break? We went down to the cafeteria, came back up to the conference room and ate our lunch. And then I gave that, I was like, yo, this is what happened in 611 and this is what happened in room 10. But we in the unit. They're my colleagues.
But they're not taking care of the patient. If they're not directly taking care of the patient, you can't discuss someone else's care with them.
Kenosha, do you agree? Why? Why? She didn't even agree. You was like, no, HIPAA wasn't broken, huh? No, listen, guys. Even if they were on the unit, even if we were in the elevator, even if we work on the same unit and we just went off or whatever, or we're in the conference room, if the care provider is not directly providing care to that client, you ain't got no business talking about their information.
So then doesn't that, oh, sorry.
Cornelius, and then
So if we go to clinicals and then we talk to our professor afterwards about what we saw, would that be breaking HIPAA?
no, it's not. You know why? Because you don't give identifying marks. Identifying
So if you didn't say, like,
identifiers.
the room of the patient,
Yes.
what the patient it was,
Yes.
you can still ask that advice, but just not identifying who that person is.
Yes.
So you could be like, alright, have a
Now, does this happen in the real world? Always? No.
Yeah.
Okay? But you got to be careful what you divulge. Wait, Kiani and then Carlos.
No, I think you kind of answered it, but like my question was kind of like, well, because nurses, like even like, for example, like Dr. Gray, she wasn't giving necessarily any identifying factors, but she was telling her, like us kind of her experience within the nursing field and like how she's dealt with patients who like this and that, and she's had this crazy case and that crazy
Oh,
case.
yeah, that's.
So that's not technically breaking HIPAA because you're not giving any identifying factors.
Yes.
But the moment that you start saying room 102 or name person.
And if it's current, yes. And let me tell y'all, before I get Carlos, each environment is different in how strict of information you could provide. We had a colleague, Professor Bregman, when she was here. She's from Hawaii. Let me tell you, that community where she was at, it was so small. A nurse just said, oh my God, went on social media, and she said that a nurse said that they went on social media and said, I had a tough day on the unit. And she just said what unit she was on, and she got in trouble for that because everybody knew who that tough client was.
Well, she didn't say tough client, she said tough unit.
Yes, but something like that. I think she just said tough client. We had a tough client today. And there was only one tough client, in other words. Something like that, to that effect. And the nurse got in trouble. Because everybody knew who that tough client was. So you have to be careful in terms of patient privacy, patient information. You got to be careful what you divulge. Just don't say nothing. Carlos.
I was just gonna say, I mean, you pretty much answered it. It's like as long as you don't divulge any
identifying markers,
should be okay.
You should be fine.
And you don't can you identify the specific
disease process?
Yeah, that or no?
No. Now, let me be real. Let's say, for example, we all on the unit, and I have a tough situation, like I need help.
Yeah.
Okay, like I'm like dealing with a client, like everything that I do or that I think is right is not working. Yeah, Carlos, you may not be directly providing care, but I can come to you for help and be like, Carlos, this is what I'm dealing with. I'm trying to insert this 4D catheter. That's not breaking HIPAA. You understand what I mean? Mm-hmm. But if I go to the unit, the scenarios or whatever that I provide, especially going into the elevator or even in the conference room. Again, if that care provider does not have any direct care that they are providing to that client, keep your mouth shut. Yes.
So say you're talking to Mason about this.
Mm-hmm.
That was Mason's patient yesterday, and today that's your patient. Can you divulge any new information to Mason?
I'm gonna tell you legally, if Mason is no longer in the case, no. I'm gonna tell you now, is it always respected? No. Okay? But you're not supposed to because Mason is not in the case. And also in terms of patient privacy, let's say that was Mason's patient yesterday, not Mason's patient today. And if Mason goes in and into the patient's chart today, when he ain't got no business being in the patient, Mason could get in trouble. And there have been employees who have been in trouble just for that alone. Like, why are you in the chart when you're not assigned to this client?
Mm-hmm. You can't look in your own chart.
You can't even look in your own chart. While you even working, no. They're gonna tell you go down in not human resources. What is it? Patient that department, some department or whatever to go get your information. Medical records.
Oh yeah.
You okay? Anton, you stretching. Okay? Are we clear as to privacy, confidentiality, and stuff like that? We're clear on that. Okay, let's see. Versus virtues. This is basically saying what it is that you do to provide, maintain virtuous, okay? Be a virtuous nurse, so to speak. You gotta know what you're doing. Competence, that's what that is. You gotta know what you're doing. If I don't know how to insert a 4D catheter correctly, that's a problem. If I don't know how to start an IV, for example, that's a problem. So I gotta be compassionate. We would hope all of the nurses would be compassionate. You should provide compassionate care. Now, Janaya, what does compassionate care mean to you?
Like you're making sure you're being like kind and like you're showing the care, like you're not being like negligent with your patient.
Okay.
You're
Understanding?
Yeah, you're being understanding and listening to their values and beliefs and.
Okay, Alexandria, compassion. What does that mean to you?
You have to show that you care. You can't go in there with an attitude of being mean to them and stuff, because you're aggravated that they don't feel good, maybe.
Okay, all right. Alejandro?
Compassionate caring for me, I would say put the patient first, kind of
putting the patient first.
Be empathetic with them, because obviously if they're there, they're having a bad day, so go in there trying your best to make them feel better about themselves and also make them better as as best as you possibly can.
All right, Cornelius, have you found the definition of compassion?
No, I'm trying to find
You
it.
trying to find it? Okay, anybody found the definition of compassionate care? Kanoshia? You know, I thought you did. Okay. Now, it's on page 124 as the list right here. I'm gonna ask you this. Who do you, y'all know House? That's your House? Dr. House?
Yeah.
Is he compassionate?
No. He's got a horrible manner.
Well, yeah.
I think he is.
He like cares about it. Yeah.
I mean,
He does like
he gets the job done.
Like above and beyond.
Compassionate in his own way.
Huh?
Like, he's compassionate in his own way, which comes off as rude and like
He's
demeaning,
competent.
but-
He's competent, that's for sure. Ah, okay. But Carlos says he's compassionate in his own way, though. How so? So you say he is compassionate?
Because if he didn't care, he wouldn't go to the length that he's going to get the diagnosis or, whatever.
But his
For
In the
his
show, he like
compassion
does
and
it though
caring
just to
not
like
different than just
prove
caring.
other people wrong.
Ooh, wait, hold on. Let me get Kiani and I'm gonna get Cornelius. What were you saying?
Well, he should, like, if he didn't care, he wouldn't go to the lengths that he goes to get the diagnoses or treatments for his patients,
Okay.
i.e., and in his own way, shape, or form, he obviously cares. Because if I don't care about Dr. Semi, I'm walking out this class right now. You know what I'm saying? So it's like, and same goes back, like, it's just, that's to say, like, if you don't care for a friend, you're not gonna show up for them or help them or try to improve their quality of life. Same goes for, like, a patient with or like a doctor with a patient.
Okay.
If I don't care,
All right,
why am I
Cornelius.
even walking in that room?
All right, Cornelius. What says thou?
I just think that there's a difference between caring and compassionately caring. You can care about like how you do your job and having like professionalism, right?
Mm-hmm.
Caring for the patient to the basic needs. But then there's like also compassionate caring, and to me that means that you're showing through not just like the verbal cues or like how you're taking care of the patient, like you're probably connecting with them on an emotional level or caring for their, higher up needs on, the Maslow's hierarchy than just the lower ones.
Just the lower ones, Mason?
I'll just say in the show, he like goes all these lengths to kind of like prove everyone else wrong. That's what he does, because everyone will say the wrong thing, he's just like, that's not it. And then he goes above and beyond to like prove it wrong.
Okay, so everybody has their own definition. You agree with what compassion is?
Compassion is
What is compassion? If I show compassion, what is that? Being empathetic, showing kindness. Trinity, what says thou?
Being able to emotionally resonate.
Ooh, emotional resonance. Okay. Oh, look at that. He's clocking. He's like, he like that. Okay, so you would, Alexandria?
I'd be like going the extra mile for them. Like, you know how some people are in the hospital for a long time and like they don't get a bath or something.
Mm-hmm.
So like going in there, like washing their hands.
But isn't that what House does? Doesn't he go the extra mile, Dr. House?
Yeah, but like in a different sense. Like,
Okay.
He just violently goes there.
He violently goes there. Okay. But yes, compassionate does mean, I'm just messing with y'all, but compassionate does mean showing empathy. Being able to have that rapport with that client, okay, that trusting relationship with that client, meeting their, not just their physiological needs, but also meeting their psychological needs as well, meeting the needs of the client holistically, okay, not just seeing one aspect, but the entire aspect of the client. That's what compassionate caring is. Taking time out for that client, even though you have limited time in terms of fulfilling your tasks for other clients, etc. So that's compassionate caring in a nutshell, okay? Of course, virtues does include self-effacement, trustworthiness, intelligence, humility, courage, and yes, there will be, nursing will humble you, trust you me, okay? Yes?
I just have a quick question before I move on from the site. When we see lists like this for testing purposes, do you care more about like us understanding what each means, or do you want us to like memorize this entirely?
Don't just know.
Because, like,
Good question.
I mean, there's a lot of like long lists
No,
of things.
Virtues, so you just you need to understand the concept. What are the virtues that help? Because memorization in these NCLEX-style questions is not going to be helpful in the sense of helping you answer the question. You need to understand the concept. Do you need to memorize? Should you memorize? It's helpful. It's let me choose my words wisely. When it comes to increasing your cognitive understanding, your cognitive application, that's the word, of these concepts, memorization alone will not help you. Okay? But you should understand the concepts together. Yes?
So when it comes to the exams, are you testing out the PowerPoint or the textbook?
Bro, since I'm on TikTok, the PowerPoint simply guides your study or guides what you should focus on in the book. So it's both. Okay. You'll notice too, I skipped some slides. Okay? I hope you paid attention to that. Okay? But this, what I spend time on, definitely spend. Okay? Alright, purposes of, okay, why we have a code of ethics, you should already know about it. It's basically our standard of care, of how we provide care to these clients. ICM guidelines to achieve the code of ethics, what you should do, in other words, is work in groups, use specific examples, collaborate with each other in terms of interdisciplinary care. This one right here is what I want to focus on, is the last bullet point. Collaborating with other professionals to apply standards in practice, education management, and research. In other words, interdisciplinary care. You need to know how to work with other disciplines as a professional. It doesn't matter if you're ASN, LVN, BSN, MSN, PhD, whatever. You need to know how to collaborate with other disciplines. And effective collaboration also includes communication, which we talked about last week, right? So in other words, for example, Shayla needs to know, okay, if this patient is declining, she needs to know who to call, right? Primary provider. Not only does she need to know who to call, she needs to know what to say and when she's providing information regarding to this client's change. That's also a form of collaborating with different disciplines. Or when Sakina has a client who needs to be bathed right away, she needs to know, okay, who is she going to delegate that task? That's a part of collaboration. Sakina is not going to call the doctor to come and say, hey, doc, I need you to come bathe this patient. You understand? The doc will have a fit. All right? So Sakina will know, okay, first of all, this patient needs to be bathed. I also have priority assessments or tasks that I need to do. So let me go delegate this to the CNA, and I need to tell the CNA or the UAP, listen, when you are turning the patient, make sure you are very careful with the right side with this client, etc. Make sure you reapply this the compression stockings after you're done taking care of the patient. She needs to make sure she communicate effectively with those different, that's part of collaboration, okay? Collaborating with different, interdisciplinary collaboration is what I was trying to say, all right? How you communicate with your individuals, and also helping them out when needed as well. That's part of collaboration. All right. This is our Bill of Rights as nurses, pretty much self-explanatory, but I'm not going to go into deep into this. However, what I want to go into, using the nursing process to make an ethical decision. Guys, this goes without saying. I don't even need to spend much time on this. So sometimes nurses will find themselves in what's called an ethical dilemma. Okay, for various reasons. Let's say, for example, let's see, Shayla has 2 patients that needs a heart transplant. One got money, one doesn't have money. Okay, and the one that doesn't have money is the one that really could benefit it more than the other one that has money. Okay, they gonna give it to the one that has money because, of course, he got money. Shayla finds herself in an ethical dilemma at this point. You can utilize the nursing process to help decide how you're going to deal with this dilemma, okay? Of course, gather all your information, identify what is exactly the issue, and then, of course, plan on how you're going to deal with this dilemma, okay? Okay, maybe she might have to go to the ethical team or whatnot. Of course, she's going to implement or act on her decision, and then after everything is said and done, for the most part, she's going to evaluate, did I make the right decision or did I not make the right decision when I dealt with this information? That's basically what that is saying, all right? Ethically relevant considerations, they're pretty much self-explanatory. I don't need to go into that. However, examples of ethical problems, which you should be familiar with because they're going to come up in some way, shape, or form. The different types of problems you may face, okay, or a nurse may face. Paternalism. Macheska, what is paternalism? Did I pronounce your name right?
Yes, you did.
Okay.
Does it have to be something with like the parents?
Let me see where you're going with this. Let me see where you're going with this. Well, Anton helped you find the answer.
You want me to read it?
Sure, go ahead, read it.
I don't want to steer anyone wrong, you know. An alert older resident who lives in a long-term care facility and who is now at high risk for fall refuses to call the nurse for assistance when getting out of bed.
That is not the definition of paternalism.
Is it?
It's like halfway down
Act,
there.
Choosing the action the patient does not want because the nurse believes it to be the patient's best interest.
Is that the definition of paternalism? Carlos and then Cornelius.
It's like when put an older patient in a care home, against their will, even though they might be functioning, they're not functioning to their full capacity, so they can't take care of themselves. They might forget to bathe when they may forget to eat.
Okay, what is paternalism though? You're giving me examples, Cornelius?
Acting as a patient's parent, so taking away like their autonomy. Like making, like, is it right to take away their autonomy, like putting up the restraints for a patient that you think might?
Okay, wait. Hold on. I just want to know what is paternalism. Somebody said it.
Making decisions for the patient.
Thank you. That's paternalism. Just like how a parent makes decisions for their children, that's what paternalism is. Now, with regards to it being a problem, we're going to talk about that. But you need to know what is paternalism when someone is the decision maker for somebody else. That's paternalism. Now, how can that be a problem? Carlos, you started saying something. You started giving an example.
Yeah, well, I mean, that was, like say for an older patient, you put them in a nursing home where you do things for them that maybe they don't want, but it's in their best interest, like they were saying.
Okay, so is it always bad? Is this the issue of paternalism? Is it always a bad thing? No?
It could be because you might go against the patient's will.
Well, but
Even
the
though you're doing
patient
the
might
right
be
thing.
a dementia patient, Alzheimer's patient. They're in and out of like reality. They don't know what's best for them. They don't know. They think that they're still 2 years old and Ma's gonna give them their boob. You know what I'm saying? Like they don't know better.
So they need somebody to
that's
make
why
a decision.
They need somebody to make those
What point
decisions.
is that a family thing
Paternalism.
and then a nursing thing? Because you can't really decide that on a patient that you're only gonna see for however long compared to their.
That's exactly.
And
what
this
you have
is
to
why
do.
it can be an ethical problem.
Well, unless you're causing intentional harm to the patient, it shouldn't cause an ethical issue. I mean, there's times when
No, but
a
Carlos,
patient's refusing a bed bath, but they are developing like all types of smells and like redness and issues. It comes to a point where no, I'm not going to force you, but I'm going to be like, hey, Mr. Smith, let's at least wipe yourself down with like a cloth or.
but that's
something.
different. You're including them.
You're
but
encouraging including them, but that's
okay,
also
but
I'm
what
almost making a
Carlos
decision
is
for, like,
saying, however, a patient who has been an older adult client being put in a nursing home against their own will. That's yes.
That's most cases.
That's most a lot of cases for real. Okay,
That's most
this is where and that's what he said. This is what this slide is saying, where it can become a problem. Now I'm gonna give you an example where it has to take place. Okay, patient come in from a motor vehicle accident. They're knocked out. Nobody to call. There's no identification, but the patient needs surgery like yesterday, or they're gonna die. Paternalism is actually appropriate at this point because we need to take care of the patient, keep them at least stable. So 2 doctors is gonna make a decision at this point and say like, yes, let's go ahead and
Well, yeah, that's what
save
I'm
the
saying.
patient.
That's what I was saying, is there's times when it's necessary.
Right.
Maybe I didn't give the best example.
No. What we're saying is, what this slide is saying is basically when paternalism can become a problem.
Oh.
Yes, when it can become an issue. Carlos, yes.
So, adding on to that, so remember when I said I broke my leg? So I was like 14 at the time.
Mm-hmm.
So when I got to the hospital, I was like, I wasn't fine, but I wasn't reacting to pain. And my parents weren't there, but they didn't give me anything until my parents got there, right?
Okay.
So if I was experiencing pain, if I was like screaming, kicking, would paternalism come into then, or would they have to wait for my parents?
No, because they would have asked you.
But I was still underage.
And he was saying
No. So when you get to OB, there's this thing called accent. It's not just. It's a form of consent from, because you are of sound mind, of age to make that decision.
Okay.
Now, let's say if you were like 2 or 3, and nobody can identify where this baby came from, this little, and we see the baby is definitely in distress, paternalism is going to have to, the care provider is going to actually have to take over, make decisions for this child until the legal guardians or the higher ups make a decision.
So paternalism really only comes into play when there's extraneous situations that are prohibiting the patient from making
It's
a
not that it
decision?
only comes into play. It's just that it comes into play a lot of times. You have physicians, patients are awake, alert, and oriented and still making decisions for clients.
Why? Isn't that
Because
a problem?
it is a problem.
But isn't that like
yeah,
the
that's what this
ethical
slide is saying. Like, this is when it can be a potential problem.
Well, how do you, what would you do as the nurse if you see this occurring?
If you see it occurring, you can either talk to the physician, depending on your
And if
relationship,
they say,
or
hey, don't freaking tell me what to do, I know what I'm doing.
talk to your superior, and also most facilities do have what's called an ethics committee that you can go in when you find yourself faced with an ethical dilemma. You can go to them. You're supposed to be able to go to them for resources on how to navigate this situation. Okay, and then they'll go and apply the nursing process just like we talked about earlier. Someone else had their hand raised, no? Okay. Then there's the issue of deception, of course. That happens a lot of time. I'm gonna tell you a real nursing scenario where deception does take place. No, I'm not gonna divulge. This is general, okay? Patient is in pain. Okay, say that they're in pain. Okay? All right. Nurse gives, the first set of Dilaudid IV, like they were supposed to. Nurse finds that the nurse thinks that the client is just always complaining of pain just for the purpose of getting their medication, their legal high, like I like to call it, okay? So when the next round is due, the nurse may, instead of giving the Dilaudid, may give an IV of fill that vial with normal saline, and then give that instead of the Dilaudid. That's deception.
Oh, did it work though?
Actually, sometimes it does.
Placebo effect.
The placebo effect.
It's real.
Sometimes it works, and a lot of times it doesn't. Some patients, I'll tell you from experience. Oh God, now me putting myself out there. Okay, patients can actually taste, even if it's a peripheral IV, they can actually taste it through their vein and be like, that ain't Dilaudid. I'm like, bro, what? I'm like, what you mean? Yes, I have experienced it, okay? That's not Dilaudid. I'm like, but I'm giving it to you, through the IV. Okay, but yes, it wasn't Dilaudid, but I knew, okay, I'll go ahead. Let me go see the vial. I'll go make up something and actually give them the real thing. Then they can say, oh, all right, there go my Dilaudid. I'm like, it happens. Okay, deception does take place. We talked about privacy on social media, allocation of another issue. Yes.
Sorry, is deception ever appropriate?
Ooh, that's a good question. Is deception ever appropriate?
From an ethical standpoint, no.
No, it's not. However, There are situations. Let's say, for example, one situation that I've seen in a clinical setting is the elderly client is of age. They don't want to tell them that they're dying of cancer. They just let them. They won't. The kids. The child won't tell them. They're just saying that, oh, you have something minor. Please don't tell the client that they have this disease.
I've seen it in
Because they know
I never
it-
understood it. I don't
Because they feel like if you go ahead and tell them, they're gonna die even sooner.
That's not how that works.
That's
well,
that-
it could be how it works.
Like
It does
the
happen.
stress could cause them
They
to
give
die.
up on life and don't even try. No, it does happen. Is it appropriate? Yes,
So do
Trinity.
you listen to them?
If you have a patient who's an addict and they keep like requesting narcotics, are you supposed to give it to them or not?
You're supposed to give it to them because this ain't rehab.
That was.
That's not rehab. Honestly speaking, that's a good question. Do we try to do it? Yeah, we do. But we're not supposed to because this is not rehabilitation. You want your dilaudid, it's due in 2 hours, go ahead and give it to them. You will be going every 2, every 4, every 3 hours, or however the frequency is.
As long as it's prescribed.
As long as it's prescribed.
Should the doctor stop prescribing? They still
Yes, they
request
can. I have had patients now, they like on dilaudid and they're like, you could clearly see that they're not in pain and they barely can talk. I had multiple patients. They have their alarm. Yes. You were speaking well like 4 hours ago. Now you can't speak. What do? Now I have to go assess your respirations and be like, listen, I can't, I'm gonna hold up. No, I want give it to me. All right, Missy Elliott. All right. What do you do? If their respiratory status is low, I hold it and I notify the physician. Right? Of course, give the antidote, etc., etc. But sometimes you're supposed to give it to them. And some people can't talk. They have a high tolerance. They're gonna one day fix, so to speak. I'm sorry to call it that way, but it is what it is. Okay. All right. Oh, conflicts concerning new technology is another ethical dilemma. I remember when y'all know about the Da Vinci. Anybody ever heard about the Da Vinci robot? So you heard about it? Yes. So what is it?
It's for surgery, right?
Yes. It's supposed to provide precise surgical cutting, like where the physician's or the surgeon's hands can't reach. This robot can actually cut and reach, with very little issues. All right. When it first came out, it was a huge deal. We don't want no robots doing surgery or whatever. So you may find there could be conflicts concerning new technology every time, because of the concerns of safety, etc., and whatnot. So that's an example. All right. Short staffing. These are pretty much self-explanatory issues, ethical problems. I want to move on to. All right. This is the ethics committee I was talking about. What purpose the ethics committee serve? They do provide education, policy making, of course. They do review cases, consult, and they try to improve the quality of service, not only of the unit or unit specific, but also a hospital or facility wide as well. The ethics committee also tries to see what's the best route of dealing with these issues. And in terms of the outcome, they do provide education to see how they can best deal with these ethical issues that can continue to arise, basically. We are advocates. Whistleblowing is definitely still an issue, unfortunately, but we should provide information as much as possible. Alrighty, I spent more time than I wanted to. Do we need a break?